Hello everyone, this is Dr. B. Welcome to my channel. Today we are going to briefly talking about heart failure. Heart failure mainly divides into four categories like right and left, systolic and diastolic. So in order to understand it better, you need to think simple. Let's begin with right and left heart failure. So venous system collects the blood from our body and brings it to the right heart pumps it to the lungs bring it to the left heart, and left heart pumps it to the body, and this circle continues again and again and again. So when right heart stops working, the blood will accumulate back in the venous system. So we are going to see it as edema in lower extremities, and also since inferior vena cava is directly connected with hepatic vein, we are going to see hepatomegaly. Also, venous distension. And what happens in the left side of the body? So when left heart stops working properly, the blood will accumulate back in the lungs, and from lungs it will accumulate back in right heart. So this pressure also eventually leads to right heart failure. And keep in mind that primary cause of right heart failure is almost always left heart failure. So the accumulated blood in lungs will lead to pulmonary edema, and also it will eventually lead to right heart failure. Patients will also experience dyspnea. So let's talk about systolic and diastolic heart failure. In systolic heart failure, there is pump dysfunction, whereas in diastolic heart failure, there is stiffness around the heart chambers. The systolic heart failure is usually due to ischemia, hypertension, viral and idiopathic causes, whereas diastolic heart failure is usually due to hypertension, infiltrative diseases, and hypertrophic cardiomyopathies. Please keep in mind that USMLE loves these questions. Systolic heart failure, usually there will be like case where alcoholic patient comes, and also where cancer patient comes in who uses doxorubicin, and they always want you to know that those two are very common causes of systolic heart failure. Also keep in mind that dilated cardiomyopathy, usually seen in young female patients, whereas hypertrophic cardiomyopathy, which is one of the most common causes of diastolic heart failure, usually seen in young male patients. So in systolic heart failure, as we said, there's decreased pump function, which leads to decreased ejection fraction, and which will increase the blood in the heart, and which means that there will be increased preload in systolic heart failure. But diastolic heart failure, there will be increased stiffness, which will lead to decreased relaxation of the heart. Together leads to decreased preload in the heart. Please keep in mind that when treating the diastolic heart failure, we shouldn't decrease the preload so much. So let's talk about treatment options. As I said earlier, in systolic heart failure, we have increased preload, so we need to decrease it. And we need to decrease afterload so we can increase our ejection fraction, and also we need to decrease our wall stress. Whereas in diastolic heart failure, we already have decreased preload, so we shouldn't decrease preload too much. But we can give diuretics. We need to control hypertension as well. For treatment options, we have ACE inhibitors, angiotensin receptor blockers, diuretics, spironolactone, and beta blocker. We also have digoxin, which improves ejection fraction, but please keep in mind that digoxin do not improve mortality. So let's talk about the subcategories of heart failure or the secondary causes that the USMLE loves to ask. Please know those because you're going to be asked about this 100%. Let's first talk about the high output heart failure, which is usually due to anemia, thyroid, beriberi, Paget, cirrhosis. So every heart failure patient needs to be tested for TSH, hemoglobin, liver function tests because of those reasons. They usually give you a patient which is in 70s or 80s, an old patient comes with sudden deafness or some heart failure symptoms, and they always want you to test on Paget. Please keep in mind that. Or if a young patient comes with sudden heart failure, you need to eliminate the secondary causes first. And the other secondary causes of heart failure is a common one in elderly as well, tachycardia-induced heart failure, which is usually due to chronic atrial fibrillation. Heart cannot compensate that persistent overwork in the body, and it leads to left ventricle dilatation and systolic heart failure. So that's all. Thanks for watching me. Please do not forget to subscribe. If you have any questions, do not hesitate to comment down below. See you later.